Welcome back to Shape of the City. What do more than 179 primary care providers in Nebraska have in common? All of them are part of a project called the Nebraska Physicians Screening Initiative. Today, we'll learn more about the progress and goals of the project with Dr. Bob Rauner from the Partnership for Healthy Lincoln and Dr. Mike Rapp from the Physician Network. Thank you both for joining me.
Thank you for asking.
Well, Dr. Rapp, let's start with you. Tell me, what exactly is the Nebraska Physicians Cancer Screening Initiative?
The Physician Screening Initiative is an effort to improve screening for colorectal cancer and for breast cancer in our citizens. It was started by Partnership for a Healthy Lincoln, which Bob Rauner started, and it's morphed into Partnership for a Healthy Nebraska because it's been so successful. We're trying to increase the rates by which all Nebraskans of the appropriate age and sex are screened for these two cancers that take so many lives every year.
Great. Now, who's participating in this initiative and how is it really getting into the community?
Well, it's actually across a number of different networks. Mike and I were at actually a meeting about a year and a half ago and kind of talked about could we bring our various organizations together and started pitching it to clinics in Lincoln initially. We have clinics from the Physician Network, which is kind of aligned with Catholic Health Initiatives. You have One Health Nebraska, which is independent clinics, some of the safety net clinics. So initially started with just Lincoln clinics, but then as it started off, we actually had some interest from some of the other clinics in his network. So clinics in Crete, Kearney, Nebraska City got involved as well. And so now where it's even expanded to fellow qualified health centers across the state as well. So.
Great. So how is this going from the physician to actually helping the patient?
Well, one of the reasons that, unfortunately not enough people get screened. Right now, probably around 60, 70% maybe at most are getting screened. The goal is to get that to at least 80% by 2018 as a national effort. And so we started looking at our rates and finding out in Nebraska at least a year and a half ago, probably closer to 50%. We've gotten some pretty significant increase already. And so getting those people screened, and what they found the most common reason people say I didn't get screened is my doctor never mentioned it. Oh. And so we tried to institutionalize it. So part of when every clinic has patients for their annual wellness exam, for example, that's one of the things they ask for, and then they track it actively. So all of Mike's clinics, they pull a number every now and then and say, okay, where are we at now? And then a couple months later, they'll pull again, okay, where are we at now? So they really set a goal for themselves.
It is the kind of screening that can't just be the physician's responsibility. In TPN, we found that it has to be the entire clinic, everyone, from the person at the front desk to the person that checks you in. Everybody has to be involved in this to make a difference.
Good. What are some of the results you've seen so far?
Well, mostly just getting the clinics to the point where they have better data they can pull and find out now that they have electronic record programs, where are we? Pull that number, see what it is, and can they make it better over time? And so I think one of the biggest things is finding out what works and what doesn't. One of the biggest barriers we're finding in the safety net clinics, unfortunately, is just lack of health insurance. There's people who get reminded and they're interested, but unfortunately don't have the health insurance to cover it. We started moving some other things, so we actually have the county medical societies working, or the Lancaster County Health Department's working on this. Dave Hum and their Cancer Coalition, they have offered free FOBT kits, which is a way to screen for blood in your stools, for example. That's something you'll see in colon cancer. So the health department's also working on this a little bit. The Cancer Society and Tamara Robinson have also been involved, so they're trying to do some messaging out in the community as well.
We've seen a definite improvement in screening percentages. Within the reporting, it's gone from as low as 30% up to 60% for either of the screenings depending on the clinic. Some of that was, as we said earlier, because the entire clinic began to change how they do things and how they record it. But I believe that there are lives being saved because of the true increase in patient screening, not just statistics, but more patients are having it done.
Great.
Yeah. And most of the clinics made a significant improvement, some quite a bit dramatic improvement. We also have some state data coming in now, though, where we actually can compare Lincoln and Lancaster County, the rest of the state, and we actually now know that actually Lincoln and Lancaster County has the highest colorectal cancer screening rate in the state right now, and for breast cancer, we're pretty close to the top as well.
Very good. What have been some of the biggest challenges to getting people in for early screening? You've sort of touched on this. It could be that they weren't reminded, could be a financial barrier. What else?
Sometimes the screening is unpleasant. Women that get mammograms complain about it. Nobody particularly enjoys colonoscopies. And so you have to get past that mindset as well and make sure they understand the consequences that can be quite severe, life-threatening, if they do not do the screening.
Do either of you have any personal stories from this project that you can share so far?
Well, we have our own relatives, for example. I have an aunt that had cancer, colon cancer, and then treated. Luckily, she survived. I think one of our best stories actually is one of the clinics, the lead physician, her own father saw one of his partners hadn't been screened. They got him screened, found out he actually had a precancerous lesion. And so she's kind of a believer in this project because her own father got a cancer caught early or before it became cancer and probably prevented that. And I think that's one of the biggest things that for colon cancer specifically, colonoscopy, not only does it detect cancer early, you can actually find polyps before they become cancer. And so you avoid the chemotherapy and radiation surgery altogether. And so there's really a solid argument for the colonoscopy side.
Good. How do people find out more about colon cancer screening or breast cancer screening in their own community?
Paying attention to the American Cancer Society ads, talking to their doctor.
Yeah, I think that one of the best things is frankly coming in for that annual exam and wellness visit. Almost all insurance plans now cover an annual wellness visit. This is one of the biggest things that are accomplished during that, is to make sure that you've been screened with the things you should be screened for. And I think a lot of people forget that a lot of insurance covers this with no copay or anything. There's a reason why Medicare, for example, wants you to come in for this, because they know that, well, not only will it help prevent illness, it actually might even save them money because treating cancer is really expensive.
Okay. Well, now somebody who isn't quite at the age yet, I'm not even sure what the appropriate age is, so why don't you tell our viewers what is the right age for a recommended age for these screenings?
For both of them, it's starting at age 50.
Okay.
For some women, you may be doing mammography at a younger age, but for the routine, everybody between the ages of around 50 to 75 should get screened for both of these. Okay. There are some high-risk conditions. So for example, with my family, my aunt she had colon cancer in her 40s. It's a little bit younger age, because if you have a family history, that puts you at a higher risk. Same thing goes with breast cancer. So some women, for example, have a hereditary form of breast cancer that can go through their family. They have a little bit different. For routine screening, it's between the ages of 50 and 75.
Very good. Okay, well, thank you both for joining me today and letting us know more about this important initiative.